chest X-ray. So, what is the radiology? This is a diagram of chest. So, we will go for a systematic approach, and after looking all the aspects of a skygram, we will give our interpretations. Okay. So first, what we will see? First thing is the airway. First thing, we will look for the airways. We all know that the airway, it is the trachea, and after the trachea at the level of the carina, it divides into right and left main bronchi. Look fast. Next, we will look the bones and the soft tissues. That means the ribs and all the areas where the soft tissues are lying. Next is the cardiac, that is the heart. Next, the diaphragm. We will look for the diaphragm. Then we will look for any effusion is there or not. Then the fields, that is the lung fields. Then we will go for the abdomen, that is the gastric part. Okay, then the last is the hilum part. That is the mediastinum and hilum. And we will give a interpretation. Before that, first we have to know that the view, whether it is antero-posterior view or the postero-anterior view. So just think about the thorax. So there are the two lungs and in between the heart. So if we take the X-ray beam from the back side and if we take from the front side. So if we take from the front side, then the predominant structure will be the heart. If we took from the back side, the predominant structure will be the lung. So to enlighten the lung, so usual shadow which is taken, that is the PAV, that is the postero-anterior view. So the both lung, you will get the lung field, you can delineate, is the right lung and left lung. So usual view is the postero-anterior view. So if this view, whether this view is the antero-posterior view or the postero-anterior view or the PA view, just look at this. This is the heart contour and entire this field, okay, you are getting the clear. And this side also you are getting clear. But if you take from the front side, then the heart shadow will be larger. That means you will not get delineate the right sided lung entirely. So this means this is the PA view, that is the postero-anterior view.
Heart shadow larger the right side or
Both, that means the both side you will get the heart structure is the predominant structure in the X-ray. So this is the postero-anterior view or the PA view. Next, whether it is taken during the inspiration or during the expiration, that is a very important. So during the inspiration, the lung get inflated. So just look here that usually the sixth rib will touch, this is the diaphragm. So if you count the rib, okay, so count it, this is the first rib, then there is the second rib, third rib, fourth, fifth and sixth rib. So the diaphragm is the middle of the diaphragm. So usually there is a sixth rib, that means the inspiratory field. Next is the exposure, whether under exposure or the over exposure.
তোমার পেশেন্ট কি পাই
তাহলে ঠিক আছে
আমি বলে রেখে এসেছি
extremity usually fourth, বুঝতে পেরেছো? Sixth, usually sixth will touches the middle of the diaphragm. Overexposure or underexposure. How do you know? Just in the midline, these all are the vertebras. This is the vertebra. এটা খুব clearly দেখে নাও. This is the vertebra. This is the vertebra. In between two vertebra, there are clear cut. You are seeing that the there is the opaque area you can see, or radiolucent area. In the X-ray, in CT we are using the term hyperdense or hypodense. In the X-ray we use the radio opaque or radiolucent. Radio opaque or radiolucent. So these two, in between there is the disc. So radiolucent. But if this disc is visible, that means radio opaque. That means the hyper exposure. That means the X-ray beam is much more given. So underexposure or hyperexposure. So you have to see these intervertebral discs. Here you are clearly there is the defined or clearly see that there is the intervertebral disc are there, but they are not radio opaque. That means this is the normal exposure. So if this is also white, then we say it is the overexposure. So underexposure, overexposure, anteroposterior, posterior anterior, and inspiration expiration. Normal underexposure, this vertebra will get black. বুঝতে পেরেছো? radiolucent হয়ে যাবে। But first come from the airway. This is the basics. Now come from the airway. Under exposure, the vertebra সেখানে রেডিও ওপেন।
কিন্তু ওভারএক্সপোজারটা হয় না
যদি ভার্টিব্রা ব্ল্যাক দেখায় তাহলে হচ্ছে আন্ডার এক্সপোজার।
ইন্টারভার্টিব্রাল ডিস্ক যদি ওপেক হয়ে যায় তাহলে হাইপার এক্সপোজার। So this is the airway. What is the name? Trachea. Trachea is coming, and there is the bifurcating right and left. It is not predominant here. Now come this slide. Is the trachea is coming. Come to this side. Trachea is coming. There is the left and right. So bifurcation is clear here. Trachea is coming, the right and there is the left. Right side is little visible, but here you can see that the trachea is coming and there is a right side and left side bifurcation is there. Right and left. So first you have to see the airway, whether the trachea is in midline or not. So trachea is in central or midline, and right and left bronchi are bifurcated and the both side equal or slightly in the right side you can say. So this is the central position of trachea. So if this trachea position get displaced, then we will interpret is as the pulling or pushing lesion in the lung. So the
ওভারএক্সপোজারের ক্ষেত্রে তো বেশি কালো হয় কালো হয়
কালো সেটাই তো ব্ল্যাক বললাম ভার্টিব্রা গুলো ব্ল্যাক ওভার এক্সপোজার মানে হোয়াইট আন্ডার মানে ভার্টিব্রা বোন আর এয়ার আলাদা করবে না, বোন এ এটা হবে, তুমি যেটা বলছো এয়ারে এটা
ও
প্যারেন্ট কাইম হবে এয়ার।
মানে প্যারেনকাইমাতে তার মানে প্যারেনকাইমাতে ওভার এক্সপোজারে বেশি কালোই হবে। আচ্ছা আচ্ছা, মানে লাং মানে লাং ফিল্ডগুলো বেশি কালো হবে আর ভিতরে বেশি
Don't go for the lung field.
প্যারেনকাইমা।
You be in the vertebra. There are two structure. One is vertebra, one is disc. Vertebra you are seeing, disc is not seen normal exposure. Okay. The vertebra seen, intervertebral disc is seen overexposure. And vertebra get black. That means the underlying. Normal থেকে ছবি দেখো। Vertebra are in between disc গুলো এর ফ্রেন্ডগুলো দেখতে নয়। Disc গুলো ঘুরে যাচ্ছে। Airway, we will go for the airway. If the airway, that means the trachea is shifted, so fast our that means the interpretation is pushing or pulling lesion. So pushing lesion, pleural effusion. Or pulling lesion, fibrosis, collapse. So from the airway, we can diagnose that the patient has pushing lesion, that means pleural effusion present or not. And next one is the pulling, that is the fibrosis or collapse is present or not. Next the bones, that is the ribs. These all are. So how to count the ribs? So we have to come from this side, okay? So this is the vertebra. So from above downwards we are coming. This is the rib, first rib. Next is the second rib. Then there is the third rib. Then there is the fourth rib. Then fifth rib. Then the sixth rib. Then the seventh rib. And also note the gap in between two ribs. So what interpretation we will do from the bones, that is the rib, if there is the rib crowding. If there is a rib crowding, that means again there is the pulling lesion, that means collapse or fibrosis or might be malignancy. Then we will bones and soft tissues. So this is the axilla. This area is the supraclavicular fossa. This is the clavicle bone. So this is the supraclavicular area, and this is the axilla, and this is the lateral wall of the chest wall. So this part is the soft tissue, and in female there is also the breast tissue. Okay. So this is the lateral of chest, axilla, supraclavicular, and the breast tissue. So we have to look on these soft tissue areas. Usually what happened in this soft tissue area, there is a subcutaneous emphysema we can get. There is the opacity on this soft tissue area, that means subcutaneous emphysema is present.
মানে কতটা opacity নরমাল, মানে কতটা opacity নরমাল?
Opacity না lucency?
সফট
Emphysema.
না, emphysema মানে এয়ার থাকবে, এয়ার
হ্যাঁ।
থাকলে ওপেকই হবে।
Ear থাকলে opaque হবে।
প্যারেনকাইমার মধ্যে থাকলে। আচ্ছা এবার এসো এখানে, তারপরে নেক্সট হচ্ছে কার্ডিয়াক বা হার্ট, ঠিক আছে? So this structure you have to describe. So from here to here, this is the right border of heart, and from this side, this is the left border of right border of heart. So in the left border of heart, which is the first structure, aortic knuckle, and here is the pulmonary artery. Then this is the, we all know, left atrium, that is the appendages part or lingular part. Then this entire part is the left ventricle, which is forming with the diaphragm is the cardiophrenic angle. And in the right side, this is the right atrium part. and above the right atrium part, this is the superior vena cava is there. Then that is the hilum part. Okay. So this is the heart borders, also known as the seal horti. Okay. So if this border we are not defining due to the pathology, that is known as the seal horti sign. So this is the cardiophrenic angle. In this X-ray, this is the cardiophrenic angle. This is the right atrium. This is the superior vena cava. Then this is the hilum part. In this side, cardiophrenic angle, left ventricle, then the left lingula, then the pulmonary artery, and this is the aortic knob or aortic duct. So from here to cardiophrenic angle, if it is clearly seen or visible, that means cardiac seal horti is maintained. If any area is get lost due to pathology, then we will say there is a seal horti sign is present. That means the cardiac border is lost, not maintaining the cardiac contour. বুঝতে পেরেছো? Now, this is the border of heart. Next is size of heart. So, this is the, if you say that there is a tangential line here and a tangential line here, so you will get the thoracic, there is a transverse maximum diameter. And if you cut a midline, okay, so from the midline, the farthest part of left ventricle, okay, so this part and farthest part of right atrium from the midline, suppose this part. So if this part A and this part is B, so this entire A plus B always should be half of thorax, less than 50%. The farthest point is this, so you take a tangential line. This is the right atrium. Suppose the farthest point is this, okay? So you take a tangential line to midline. So if it is A, if it is B, so always A plus B, that is less than 50%. That is the half of thorax. So half of thorax. So suppose this that means the diameter is by looking, or this diameter by looking, it is and also this diameter by looking, it is half of the, this part is the thorax, so this is the half of the thorax, so it is the normal. But this part there, by looking, there is a mild cardiomegaly is present. Cardiomegaly is present by looking this. Just to compare it. So this is the half of the thorax. This part is less than half of the thorax. This part is also more or less, but this part definitely more than half of the thorax. So this is the size of the heart. Next thing is, so what is this structure? Left ventricle. What is this structure? Yes, left atrium appendix part or the terminal part. So the classic disease, that is the mitral stenosis, we all know that the which chamber of the heart get dilate first? Left atrium. So if this part get dilated, so there will be the structure like this. So instead of this coving, the structure will be like this. So if the structure is like this, then this we will say this is the straightening of left heart body. So which is the classic diagnosis of mitral stenosis. And same things, what is this?
Right atrium.
This is the right atrium. Okay, the right atrium. So if the left atrium gets enlarged, so again this will come here. So then what happened? If left atrium get enlarged, will be like this. So from the beginning there is a right atrium. Now the left atrium comes. So there will be double contour sign, but double density sign of the right heart border, which is also known as the mitral stenosis. This is the right atrium or right heart border. So if the left atrium get enlarged, so if it is get enlarged, okay, so there will be another border. This is known as the double density but double contour of the heart. So from the heart, what we have to look for? Once we are going for interpretation, first is the border of the heart, next is the chamber or the size of the heart, and the third is the contour of the heart. So these three things we have to interpret from the heart. This is the diaphragm. So left and right dome of diaphragm. They are forming with the heart cardiophrenic angle. If that get obliterated, we will say Silotti sign. But this dome, left dome of diaphragm, again in the termination point of the thoracic rib cage, there is again an angle. This is known as the costophrenic. So we know that the cardiophrenic angle get obliterated. This is the cardiac Silotti sign is present. Same things if the dome of diaphragm with the rib cage, that is the costophrenic angle, get obliterated, then we call it the pleural effusion is present. Pleural effusion. And usually due to gravity pulling, they will form a curve-like structure which is known as the meniscus. So the costophrenic angle of diaphragm get obliterated with a upward concavity that is known as the meniscus. So what do you mean by obliterated? That means the radio opaque or radio opacity. So right dome of diaphragm, left dome of diaphragm, right cardiophrenic angle, right costophrenic angle, left cardiophrenic angle, right cardiophrenic angle, right costophrenic angle, and below the diaphragm, in the left side there is the stomach. So if in the stomach food is there, that is will appear as a radio opaque. If the fundic gas shadow is there, that will appear as a radiolucent. Same thing in the right side. If there is liver, so due to hepatic density, there will be radio opacities there. And in the between, if here the small intestine is there is the food bolus is there, then radio opacity. Or there is the bowel is air is there will be radiolucency. But in this picture, if you see all the intestine at a time, there is no air, it is indicating. In the fundus area, there is no air, it is indicating. In the liver area, so entire part, so that means there might be ascites. As the entire part is radio opaque. So some homogeneous things is entire abdomen is there. So diaphragm examination will tell the above the diaphragm pathology and below the diaphragm pathology. Food intake অবশ্যই, but এরকম হবে যে intestine all জায়গায় foods আছে. There some part there will be air, at least. So that is the more suggestive. So above the diaphragm pathology and below. And in surgical emergency patient, you will know there is a air fluid level also you can get in the abdominal part by seeing the diaphragm.
লিভার থাকলে ওখানে কালো হবে।
Why? তাহলে ডায়াফ্রামে আমরা কি কি লক্ষ্য করব? কার্ডিওফ্রেনিক অ্যাঙ্গেল, কস্টোফ্রেনিক অ্যাঙ্গেল, তার সাথে হচ্ছে বিলো দ্য ডোম অফ ডায়াফ্রাম, তার সাথে হচ্ছে এখানে ফান্ডিক গ্যাস শ্যাডো, তার সাথে হচ্ছে এন্টায়ার হোয়াইট আউট কিনা সেটাও আমরা দেখব। আর এবার দেখো এখানে তুমি যদি রিব কাউন্ট করো, ফার্স্ট রিব, সেকেন্ড রিব, থার্ড রিব, ফোর্থ রিব, ফিফথ রিব, সিক্সথ রিব, দেখো ডোম অফ ডায়াফ্রামকে টাচ করছে। ঠিক, diaphragm always don't jump from diaphragm till you have looked the rib count, and this dome sometimes get flattened. So if you get a flattened diaphragm, flat diaphragm, that is very much suggestive of hyperinflation
Inflation.
of the lungs, which has pushed the diaphragm below. তাহলে diaphragm এর these all things you have to see whether the diaphragm dome is flat or not, that means diaphragm pushed down, diaphragm dome is present or not, all the angles are present or not, and also the fundic gas shadow is present or not. So this is the diaphragm. Then the effusions. Suppose if you see these things, so this is the dome of diaphragm, right? But if you see minutely, there is the right dome of diaphragm, this is the left dome of diaphragm, but this costophrenic angle get obliterated. So that's a very much suggestive of the pleural effusions.
বাট মেনিসকাস সাইন তো নেই।
In this area, there is the advanced picture. If you see that this entire area, okay, so this is the air and below is the fluid. So this is known as
Air
the
fluid.
pneumo and water. So
হাইড্রোনিউমোথোরাক্স।
hydropneumothorax. You have to look from the closer. There is a margin. This is the margin. What margin is this? It is the pleura. This is the pleura. This is the visceral pleura, and there is the parietal pleura. So in between the pleura, if the air is there, this is known as the pneumothorax, and below is the water. How do I confirm water? Because the dome of diaphragm, if we inspect, that the costophrenic angle get obliterated. So this is the fluid or water, and this is the air. Because I am clearly seeing this is the visceral pleura and parietal pleura. So this structure is the hydropneumothorax.
The visceral fluid, parietal fluid মধ্যে আলাদা কি কিছু মানে একটু বলার একবার।
Like if we go for the anatomy, so there is the parietal pleura which is with the ribs. So in the ribs, this structure is the parietal pleura, and this area, if you see that this area is air. Why we are saying this is air? Because there is the absence of the lung fields. There is no lung fields are there. So that's why this is the air. So air and effusions. So this is known as the hydropneumothorax. Lunar or curvilinear. There is the upper concave border. So then the question is coming, why it is the straight line? If we go up, that there is some collection of air in between the parietal pleura and visceral pleura, and there is a clear margin is there. If you see, clear margin is there. So that's why this is a pneumo part and this is the fluid part. So this is known as the hydropneumothorax. Just think about the anatomy of the lungs. So the structure, there are alveoli. So there will be some air filled space. there is some parenchyma or lung tissue, and there is some blood vessels. So all these three structure is the lung anatomy. So we will see in this area that why the structure is like this, because here the lung parenchyma is there, and if you see minutely, there are some vascular, that means the reticular things, which is that means suggesting that the blood vessels. Okay. So these blood vessels structure is there. Look from the close. There is some blood vessels. Just look it. There is blood vessels is there. Yes. So there are the blood vessels is there, and also there is some lung tissue is there, and also there is the alveolar structure is there. So all the three structure are giving the lung fields. So if any area is loss of lung tissue, that means there is a damage of the lungs. That means emphysema is there. That will loss of the lung tissue. That means this vascular markings and bronchial markings, which is known as bronchovascular markings. So always look for the lung fields. এটা lung fields তো বোঝা যাচ্ছে, ব্রঙ্কিয়াল এবং ভাস্কুলার মার্কিংস গুলো বোঝা যাচ্ছে। কারো কি অসুবিধা হচ্ছে? কাছে এসো দেখো।
ভাস্কুলার রেটিকুলার সেলস
এই যে আছে তো, এগুলোই হচ্ছে ব্রঙ্কোভাস্কুলার মার্কিংস। তুমি অত খেয়ে পাবে না।
এটা ছবি
এটা মার্কিংস মিন্স ব্রঙ্কোভাস্কুলার মার্কিংস। এটা এটা আচ্ছা, ওটা আমরা আসবো। এখন যেহেতু বলছো তাহলে বলে দিই, এটা তো হাইলাম। যে হাইলাম যে আছে, এখানে পালমোনারি যে ট্রাঙ্ক আছে, লাংস, দেয়ার ইজ দ্য রাইট সাইড থ্রি লোব। দিস দ্য আপার লোব, মিডল লোব অ্যান্ড লোয়ার লোব। তাহলে লোয়ার লোবে যে পালমোনারি আর্টারি ব্রাঞ্চ, দ্যাট ইজ ডাইলেটেড। বুঝতে পেরেছো? এটাকে আমরা হাইলাম কনজেস্টেড বলি, বা হাইলার এনলার্জমেন্ট বলি, বা হাইলার কনজেশন। তাহলে এটা লাং ফিল্ডস। সো within the lung fields we will see the bronchi, vascular markings and parenchymal markings. So bronchovascular markings and lung parenchyma. তারপরে কিছু লাং ফিল্ডস এর পরে গ্যাস্ট্রিক বাবল, সেটা আমরা বলে দিই। So এখানে দেখো, this is the aortic knob, there is the main pulmonary artery, এবং main pulmonary artery এখানে দেখো ব্রাঞ্চিংটা হচ্ছে from right side also. If this is the right atrium, then superior vena cava, then the pulmonary artery, সেখান থেকে ব্রাঞ্চিংটা হচ্ছে। So this part is the hilum. তাহলে হাইলাম হচ্ছে, that is the pulmonary artery and aortic knuckle. So this part is the hilum. Here superior vena cava get ended, then again the pulmonary artery, this part is the hilum. সেই হাইলাম এরিয়াটা আমরা দেখব। আচ্ছা, এটা অ্যান্টেরিয়র ভিউ। যদি আমরা ল্যাটারাল একটা ভিউ মারি, তাহলে হাইলামের কিন্তু তিনটে এরিয়া হয়ে যাবে, অ্যান্টেরিয়র, মিডল এবং পোস্টেরিয়র, যেটাকে আমরা মিডিয়াস্টিনাম বলি। তাহলে কেউ ল্যাটারালি দাঁড়িয়ে আছে, সেখান থেকে দেখছো, তাহলে হাইলাম যে এরিয়া, সেখানে অ্যান্টেরিয়র পার্টও থাকবে, মিডল পার্টও থাকবে, পোস্টেরিয়র পার্ট। Is the ventricle, left ventricle, left atrium is the pulmonary artery. There are three branches. In right side two, left side two branches. The upper and lower. There is the divisions, and in this side also there is the right atrium, then the superior vena cava. Then again there is the right pulmonary artery. So there is the lower, middle, and upper. So this part is the hilum of lung. So hilum of lung means the pulmonary vasculature, which is supplying the lungs. আচ্ছা বলো এবার তোমার ডায়াগনোসিস বলো একজন দাঁড়িয়ে সবাই বলবে প্রত্যেক কেউ এ করবে শুধু তোমার দিয়ে শুরু বলো This is a skygram of the chest which is showing posterior anterior view with normal exposure
taken in
inspiratory
inspiratory
field
phase.
and the airways bolo
Taken the midline,
trachea central
central,
bones no rib crowding
no rib covering,
heart
normal,
normal heart contour তারপর diaphragm
cardiac silhouette,
diaphragm,
both the dome of diaphragm is present costophrenic angle present cardiophrenic angle in the right side obliterated there is no obliteration of costophrenic angle so no pleural effusion তারপর lung fields একটা বলো left lung fields bronchovascular markings and normal parenchyma right lung fields very good so there
reduced
is a
collapse,
straight line there's a clearly visible straight line and just this side of the straight line we are seeing the bronchovascular markings and lung parenchyma but this side there is absent total loss of bronchovascular markings and lung parenchyma so this is the yard this entire part is the yard so the yard is in between the lungs and the with the rib cage that's the parietal pleura so parietal pleura and lungs there is the so there is the yard so from the lung field there is the right sided pneumothorax চলো তারপরে হাইলাম বলতে না
এখানে pulmonary
বলো হাইলাম both the হাইলাম without congestion hilum are normal both the hilum are normal তারপর আন্ডিক গ্যাস শ্যাডো প্রেজেন্ট বলো হ্যাঁ এই একটা কথা বলতে 8 পয়েন্টস পর পর বলো এটা দেখো আর বলো সবগুলো বলো জোরে বলো সবাই এখানে এরিয়াটা দেখা এতটুকু তো কনজেশন মানে এরকম
মানে ওটা একটু বেশি এরিয়া নিয়ে থাকবে হ্যাঁ মানে বেশি ফুলে যাবে তাহলে ওটা ডিফারেন্সিয়েট করবো কিভাবে
এই ছোট একটা ওয়ার্ড বলো
স্ট্রেট লাইন
যেটা কোলাপস নয়
ট্র্যাক দিয়ে তাই তো বলছি কালো হবে
দেখে না তো উপরেরগুলো দেখে না তুই এগুলো ক্লিয়ারলি ডিফারেন্সিয়েটই করতে পারবি না নর্মালি বাকিগুলো দেখে কতটা কালো নর্মালি গেছে
সাপোজ ধরো এই এরিয়াটা you have blocked this area by a foreign body or you have blocked this area by suppose there is the epithelial cell there is a malignancy it is growing and growing and growing and growing and growing. So that in the distal part of the lungs there will be no ventilation So what oxygen you are taking, that will not go in this part. So just if you go further, there is the left bronchi, main bronchi, divided into, that is the for the lower lobe, for the middle or lingular lobe, and the upper lobe. There are three main bronchi. Okay. So these three bronchi part will not get ventilated. So this entire lungs, the air what is present after 1 month or after 2 weeks, that air also get absorbed. That air get absorbed, and the entire part will get collapsed, and you will see as a radio opaque structure here. So if the block is in the left main bronchi, if the block is here, due to there is a malignancy, epithelial cell is growing and growing, we say endobronchial growth or endobronchial malignancy, then this part of the lung will be normal, but this part will get the obliterated. Okay, because the aerated part here, that air get absorbed and that will collapse. Suppose that if this part, then the middle area, or this part you will get. So the collapse will not happen from up to down. So either the collapse of upper lobe, or the collapse of lower lobe, or the collapse of the middle lobe. So if you say that the upper lobe main bronchi is blocked or occlusion due to endobronchial growth, there will be upper lobe collapse. But it will not happen from above to downward, all get collapsed. You get it? If it is in the main bronchi, then we will get the collapse. And the same things in cases of collapse, this is the pulling lesion. So trachea will be shifted to the same side. But pneumothorax, this is a pushing lesion. The trachea will be shifted to opposite side. বুঝতে পারছো? হ্যাঁ, আজ প্রত্যেকটা আমরা ধরে ধরেই করি। না, এটা তো অ্যানালগ, ডিজিটাল এক্সরে তো নয়। এই জন্য মেন প্যাথোলজিটাই